Fungal infection is a very superficial infection of skin. It usually does not go very deep in our skin. The first layer, the epidermis of the skin, is where the fungus infects us. It goes by the name of ringworm, tinea, jock's itch, Dobie's itch, or fungal infection, as we normally say. So fungal infections are caused by moisture on the skin. So any kind of infection on skin, bacterial, fungal, is very likely to develop and is very likely to affect skin if your skin is very wet, has a lot of moisture in it. It's very damp, if at all. So the biggest reason for us to catch these infections is damp skin. Whenever you feel that you have excessive itching, there might be pain also if there is some infection, some secondary bacterial infection on it. But yes, the major symptom is, of course, itching. It usually starts from the body folds. It could start from your groins, your buttocks, your axillae, your inframammary, which is under the breast, below the breast area. And then, of course, once it's been there for a long time, it can spread to everywhere, all over your body, even your face and nails. The treatment is done 100% by a dermatologist. This really needs to be told right now because fungal infections are rampant nowadays. And the problem is that because we in India we don't have very strict regulations. So these patients are often prescribed over-the-counter steroid combination creams, either by general physicians or by chemists themselves, or by other relative or some salon person, and they end up putting steroid combination creams, which initially do give rise to some improvement, but in the long run make your fungus even more resistant to treatment and damages the skin as well. So we should always go to a dermat and take the treatment. There are different types of fungal infections and different types of medications which work for particular fungal infections. So if the combination is right, usually your patient, when he comes back for a follow-up after 2 weeks, the patient is going to tell you that they're already seeing at least 50-60% of improvement, and the rest of it can happen in the next 2 to 3 weeks, maximum 2 months. As I mentioned, that fungus basically happens because of moisture in our skin. So if I tell you this, you might not understand completely what am I saying, because if you're sitting with me right now, we definitely don't have moisture anywhere. Then how come we are saying that we should always keep it moisture free? I'll give you certain tips, certain examples, and then that will make you understand. The first of which is when you come out after taking a bath, you should always give 5 minutes extra every day to dry your skin completely and then wear clothes. We are all always in a hurry after taking a bath, and we end up not drying our skin completely and we wear our clothes. So that kind of seals the moisture that was there. It stays on your skin for a long time and it can be a big trigger. So no moisture on the skin. Also when you wear your clothes, the clothes should also be dry. So especially in rainy season, there are times when our clothes are not completely dry. They still have some dampness and some moisture in them, and we end up wearing them. So that is a big no-no. So dry skin and dry clothes. And when I say dry, I don't mean don't put your moisturizer. I mean don't keep it wet. So they're two different things. So dry skin, dry clothes. Then third thing is iron your clothes. Everything, including undergarments. Ironing basically destroys, damages a lot of bacteria and fungus from the clothes. It's almost like, a sanitization process of clothes. So ironing really helps. Then fourth thing is, if you, whenever we go to the washroom, if we are going for the washroom or for freshening up, we as Indians, we don't use toilet paper. We usually use water. So very strongly advised to use toilet paper every time that you use the washroom, so that whenever there's even if a little bit of wetness because of few urine droplets that are there, or maybe because you've just washed yourself up after freshening up, we want to make it 100% dry before we wear our underwear. It's a very important tip. So you start using toilet paper and make sure that your skin is dry. And then the last thing is, of course, to wear loose cotton breathable clothes and fabrics, so that you're letting your skin breathe and it is not catching fungal infection a lot. So whenever you're at home, avoid wearing undergarments, wear loose clothes. When you're going to bed, sleeping, avoid wear your undergarments. And even during the rest of the day, try to wear loose fitting cotton clothes instead of wearing denims and jeggings and tights and leggings. So these few tips will always make sure that you don't catch any fungal infection.